She had a concave face, a longer face, and she had this jaw really reclined. Doesn't hurt? Or it hurts a little bit? Hurts a lot.
Not yet.
Not much. Wow, that's great. Try on this side also. So this is day 7 now, and she's a very brave girl. She says she's not having so much pain, but I know for sure that she's having some pain because you can see some. Okay. So we've done what we call as a bimaxillary surgery, and that means we've done surgery both on the upper and the lower jaw. This was a pretty major one. We're going to show you how she looked before. She had a concave face, a longer face, and she had this jaw really reclined. Posterior airway was less. Those are all not good things. So, okay. Right.
What?
But you're a very brave girl, okay? And I have to say, especially initially, when there was a lot of pain. Cool. Right. அவங்களுக்கு ஒரு மிரர் வேணா கொண்டு வா கொண்டு வர சொல்லு பிடிச்சிக்கிது. So we're going to show you the side view also. Look at that. So that's the kind of improvement we've got straight away. Look at that teeth. Look at that concave. Okay, smile a little bit. So she's able to smile just a little bit now because of the fact that there's still a lot of swelling and there's a little bit of incision. What?
Only the thing.
Only that you feel a little bit down.
Yeah.
At this swelling, you feel anything?
No.
That will come down. Because it's all swelling from the surgery, this will go totally in. Even this will go in, okay? The swelling everywhere, all of that will settle down very well.
Only this one is my concern now.
That is a little bit coming down, you think?
Yeah.
Can you smile? See? It will take some time. See, these muscles are all detached. This is detached. This is detached.
Should be a little back actually. I feel.
The upper jaw
Yeah.
look like that. So now see the before and after. Look your face on the side. Look here. Stand like that and look. Can you see that? Okay, I'll do one thing. Come to the mirror. This I can show you clearer. See like this. Turn like that a little bit and now see the mirror. So you see this? It should be, this is the right way it should be. This point should be same, which is same. So all the measurements are taken and then the surgery is done with planning. What happens? There's a lot of swelling. Muscles have to attach. Look up. Can you see a little bit more swelling here than here? Because there's a small cut there. That's for giving anesthesia. So that's why this area is a little bit more swollen. But that will come down. Okay? Okay. Photos. You can see in the mirror maybe the differences.
Yeah, I can see this. But the concern is this.
The teeth show. So the teeth show will reduce because the lip will slowly come down.
It's little numb here.
Yeah, it was only little numb. So that's good news.
Not little. I can't feel that.
How much part is numb?
This one.
So it's a numb here?
No.
Okay, here? No. Only here?
Split.
That's superb. Because when we do sagittal split, genioplasty and all of this, people usually say numbness this much after 1 week. So for you it's only so much. It will become 100% okay.
Yeah, this one is also.
A little numb there. This much area can be numb usually, and all of that, the numbness slowly comes back every day. So after the surgery was over, did you find the numbness more than this? It was the same. Today after we removed the pack, you're feeling any better relaxation, or how are you feeling? It feels like some pressure is taken off. Okay, so you're feeling more relaxed. But don't do like that, yeah. We just have to let it heal. See, the upper jaw is really back for you. Really back. So when you're bringing it a lot forwards, all these things are normal. It takes a while, You can't expect results in, believe me, 7 days the results that you've got is already nice. Today is just the 7th day. I think you're doing very, very well. Yeah. And all of this will go down, and then, okay, we can show you the teeth also. Just show the teeth, do this. You can see that. And that's the bite. And this is this side. And this side also your bite. There's a huge gap. We corrected that. There's no gap now. It's come forwards. And this angle, which was like this, will be now a much more straighter, nicer one. All the way it will be nice, not just like this. And here there was no angle. It was just like a C. Now it's not going to be like a C. It's already there's a step and an angle. Okay. So the quick message is that bi-jaw surgeries are major orthognathic jaw surgeries. A lot of people are scared about it, but I think if you do a proper planning and get it done with experienced hands who have good teams, then it's very predictable. It's very satisfying for both the surgeon, the parents, the patient, and everyone. But you have to remember it's not a minor surgery, and because bones are detached, because muscles are detached, because they are reattached in a different position, so it takes time. Bone healing minimum is 4 weeks. In our case, we've got multiple plates and screws and lots of cuts both sagitally and horizontally, so that's going to heal maybe in 6 weeks, basic healing. And then of course the muscles have to attach, that you have to give a few more weeks. And then the patients sometimes even tell me that they took about 3-4 months, or rarely even up to 6 months, before they started feeling your face like how you felt before surgery. That comfort will take some months. Money, it will take, इतना धीरे धीरे से पूरा आपको नॉर्मल होते रहेगा. देखने के लिए 4 हफ्ते बाद किसी को पता नहीं चलेगा, सूजन भी बहुत कम होते जाएगा, लेकिन आपको महसूस होगा अरे मेरा टंग थोड़ा ऊपर स्टिक कर रहा है, ये दांत कुछ है, लिप टाइट है, या यहाँ पे थोड़ा सा नमनेस है, यहाँ पे टाइटनेस है, ये सब हो सकता है. बट ये सब सही हो जाएगा आपको. साइड इफ़ेक्ट्स तो मेन प्रॉब्लम हो सकता है अक्लूजल डिरेंजमेंट, मतलब बाइट में कोई इश्यू, तो वो अभी आपको नहीं है, आपका परफेक्ट है सब कुछ. और भी आपको परफेक्ट चाहिए, दांत के बीच में जो गैप है मैंने आपको ऑलरेडी बता दिया. 2 महीने के बाद आप जब घर चले जाओगे उड़ीसा, वहाँ पे आपको ब्रेसेस लगा सकते हैं, कोई भी दिक्कत नहीं है, वो सेपरेट साइड बाय साइड हो जाएगा. और 1 हफ्ता आपको थोड़ा माउथ केयरफुली करना पड़ेगा, बिकॉज मुंह के अंदर से सारा सर्जरी किए गए तो इन्फेक्शन नहीं होना चाहिए. फिलहाल अब तक आपको IV एंटीबायोटिक्स मिल रहा है 4-5 दिन, तो ठीक है. अब बंद करेंगे वो सब, तो आपका ओरल हाइजीन और भी केयरफुल होना पड़ेगा. और साइड में लेटना नहीं, सोना नहीं, सीधा सो जाओ थोड़ी दिनों के लिए. एक्सरसाइज मत करो 1.5 months. हार्ड फूड मत खाओ 1 month. दाल चावल मतलब और 1 हफ्ता के बाद ओके. अभी से इडली भी ओके, रियली सॉफ्ट ब्रेड ऐसा, बट प्रिफरेबली लॉट ऑफ लिक्विड, लॉट ऑफ स्मूदीज, लॉट ऑफ जूसेस, लॉट ऑफ सूप्स एंड लेस ऑफ चूई थिंग्स. हाँ, वो ऐसे चलने दो 1 हफ्ता, बिकॉज सेफ्टी इज़ बेटर. कुछ हो गया तो वो निकाल देंगे अभी स्टिचेस डॉक्टर लोग आपका. तो वहाँ पे हमने अनेस्थीसिया दिया था, तो इसके वजह से था कि आपका पूरा फेस ओपन था सर्जरी के टाइम पे। आपको कितना दर्द हुआ ये बताइए, सब पेशेंट को एक बहुत रहता है, आप बताइए आपको दर्द कितना हुआ? हाँ नहीं, अभी भी बताओ, पहले भी?
अभी I don't feel any pain.
Really?
It's just like I was waxing my face and it's
हाँ, तो that is some pain, okay.
I mean there is no pain. I didn't
हाँ.
feel any pain for that.
Okay.
I was
After
earlier-
surgery?
After surgery, when it was engulfing something, no?
हाँ.
I mean,
Swallowing something?
or from nose that
Phlegm was coming
yeah.
down.
From that time, I can't sneeze, right?
Okay.
So I need to go through that mouth.
Okay.
That was a
Discomfort,
yeah.
but no pain. Not much pain.
Not much pain. Earlier it was there. Yeah,
Okay.
Little bit.
Little bit.
Yeah.
So you see that this is not what all patients say. Some patients have a little bit more pain than her. I think I told in the beginning she's a brave girl. She's not having pain when we put it off. She says it's just like waxing. So it hurts a bit. It hurts a lot actually. And other things doesn't hurt so much because you know when the patient comes out of anesthesia, we give you injections. So you don't feel much. So you're quite comfortable and everything. Alright, so she's a little bit concerned that her front teeth are a little bit more down, and she's also concerned about tightness. So this is like wearing a new shoe. Even that takes a few days, you know. This takes a few weeks because we've moved a lot. I'm going to show you a scan also. आपका scan भी निकालेंगे. मैं आपको scan में भी दिखाऊंगा. I'll show you कितना movement हुआ है. तब आपको मतलब because you're educated, you will be able to understand. अरे बाप रे इतना हुआ है कि because all of that is related ना आपके फेस में जो आपको देख पाओगे स्कैन में.
When you take the recent scan,
अभी निकालेंगे ना. Yeah, because we removed everything. We'll take a scan now. Scan it. That's better. We'll first take the scan, and I'll finish your second part of the consultation.
Coronoplasty.
Yeah. You take the scan and come because when the scan is getting ready, she'll do that.